We are continuing our Summer Beauty Week here in Canada M, and today we're focusing on hair removal. Many people are throwing away the razor and opting for laser hair removal treatments. But does it work and how safe is it? Joining us now is Dr. Stephen Mulholland, Director of Cosmetic Plastic Surgery at the Spa Medica Centre in Toronto. Good morning to you. And this is Leslie, who's going to actually have some hair removed in just a second. But tell me, what is laser hair removal?
Laser hair removal is the use of light energy or radio frequency energy or both to potentially obliterate the little factory workers that make a hair shaft. So it's using light to destroy hair so it doesn't come back.
You know, when people hear the word laser, they think laser eye surgery. You have to go to a specialist to get that done. Where should people get this done?
Well, laser hair removal is associated with some risk, so I always advocate going to a medically controlled and delivered laser hair removal center. There are the risks of burns and pigmentation changes. Generally, it's a very safe procedure, but I think patients need to understand what the risks and benefits are, and it's not treated as a salon therapy.
Okay, now we have now obviously you've brought your laser with you, and this is Leslie, who's generously volunteered to have some hair removed. So tell us what you're going to do here.
Well, this is one of the many systems that we use in our clinic because there's no one ideal system for all hair types. And Leslie, as you see, is a fair-haired person. So the nice new things about hair removal, you can treat tanned people, you can treat dark-skinned patients, and you can treat gray, blonde, and fair-haired people, which you couldn't before. Most systems are the same, no matter what the maker. You generally use an aqueous gel, and you just put a little ultrasound gel or aqueous gel on an area that you want to treat.
So you would put the gel wherever you're going to remove
For example,
the hair.
for women, it's legs, bikini, underarms, and facial hair. For men, it tends to be back and neck areas.
And more men are coming now, aren't they?
It's quite amazing, Jeff. Actually, 6 years ago when we started hair removal at Spa Medica, it was less than 1% of the people we saw. Now it's 25% of our hair removal clients.
See, do you think their wives are going and then saying, "Oh, honey, you should go there for that back hair"?
I think they're just tired of perhaps having their back curled, of going through 5 dress shirts a week.
Yeah, no kidding.
Those types of things, because it is...
Okay, now you're about to put the laser on, right?
This is an applicator, and all lasers will have a handpiece that goes to the skin to deliver the energy and contain it within the skin. And so you hit the ready button, you contain the energy on the skin, and you fire. And usually there's a bright flash of light. That flash of light has directed the energy into the skin. You don't need to have a hairy arm. In fact, we shave down to the skin. As long as the client hasn't waxed, we can go ahead and treat. And you make several pulses.
Let me ask Leslie, what does that feel like?
It's just a slight pinch.
Just, it feels like a little pinch?
Yep.
Yeah.
What most clients say when they're having hair removal, oh, this is less than waxing, and this is less than electrolysis, but it still causes pain.
Noticing that's quite bright, actually.
Yes.
Yeah, when you're... Please don't look at the laser.
Well, the goal of this treatment is to kill a hair follicle, so we have to derive enough energy into the skin to accomplish that.
So, and you mentioned you have different types of units for different types of skin and types and hair types.
We have about 5 lasers for different hair types, different skin types, different thicknesses of hair.
Now, how long will this last?
Generally, we tell clients that depending on their hair and skin type, every time they come in, they'll get about 20% of the hair follicles dying and not coming back. So they come in every 3 months, and most clients will achieve up to 75% or more permanent reduction of hair not coming back. Now, there's some clients that don't get any permanent reduction and the hair always comes back, and there's some clients that get close to 100%.
And what does this cost?
It depends on the site. The large sites might run in Toronto anywhere, really in Canada, anywhere from $500 to $1,500 to do a whole leg each session. For medium zones, for example, half a leg or a man's back, you're looking at maybe $300 to $900. And for small zones, which are the most common in women, the lips, the chin, the facial areas, the armpit, anywhere between $75 and $300.
And is that, I'm sorry, is that per visit or?
Per visit.
Per visit. So, and you're talking maybe 4 or 5 visits.
Most centers, they sell you a package or one by one, depending on how you want to do it.
Now, and you mentioned this, there are risks. What are those risks?
It's very important that when the client comes in that they understand this is high energy and it's not a salon treatment. With the high energy comes the risk of burning, scarring, pigmentation changes, and discolored skin that looks mottled. And it's up to us as physicians who are delivering a cosmetic skin treatment to select the right patient and the right laser.
And here we have an example, of course, of obviously something gone terribly wrong here.
You have somebody who's got a darker skin type. You need to be very, very careful on darker skin types because their melanin, the color in the skin, will pick up the energy, not the hair. And she's been burnt and striped.
What kind of things should people who are considering getting this done ask you when they go in?
I think across the country, any of your viewers should ask, how long have you been doing this? Do you have a physician who has an interest in this clinic and oversees my care? If a business is running a hair removal salon, they can just close up shop and open another limited liability company. We as physicians have to stand beside our medical license and treat our patients with a complication or not. So is a doctor involved? How long have you been doing it? How many patients have you treated? And what kind of complications have you seen, and how do we treat them if you get them?
And I guess under what circumstances wouldn't you treat someone?
Right. Well, we wouldn't treat them if they had unrealistic expectations. If this is going to resuscitate a failing marriage or get them out of a profound depression, that's not a good medical education. So they want to have a control of their hair, and if they'd be profoundly unhappy if they got nothing less than 100% reduction, then they're not good clients. They have to accept that maybe 50% permanent reduction, 70% permanent reduction, and they have to then be medically cleared. No light sensitizing medications, no very, very dark tan, and accepting of the risk.
Yeah, and you go through a questionnaire, I'm sure.
Absolutely.
Dr. Steve Mulholland, thank you very much.
Thank you, Jeff.
Leslie, thank you for being the guinea pig here this morning. Worked out nice, very soft as well. That's it. We'll be back with more after this. Stay with us.